Tiger Woods is out again. He's just had another back surgery. From what's being said in the press is he had a surgery to remove fragments of disc from his spine. If you remember several years ago, I spoke about Tiger Woods and said that once he has a surgery to fuse that lowest level of his spine, he's going to get back to winning. So he had that surgery in 2017, and sure enough, 2018, he won the Masters. Okay? So the type of surgery he had is what's called an anterior lumbar interbody fusion. Remember, he'd had 2 back surgeries prior to that to remove disc fragments, okay, from disc herniations. Now, if you think about the spine, every bone in the spine has a pillow in between it, or a cushion in between it, that's called a disc, okay, an intervertebral disc. That disc is similar to a jelly donut or those pieces of chewing gum that have a gooey center. If you squeeze that jelly donut and the jelly starts to squirt out, that's a disc herniation. That part of the jelly that's squirting out is a disc fragment. And if it's pushing on a nerve, it'll irritate that nerve. Okay? It can cause muscle weakness. So he had a surgery to remove a disc fragment way back when. He had another surgery to remove a disc fragment, whether it was a reherniation or there was more disc that needed to remove from the first surgery. He finally had it fused, so he no longer had pressure on that nerve, and he was pain-free and back to playing golf, and he won the Masters. So here's what I think may have happened. He either has bone spurs, in other words, bone around the area that he had the surgery that's now irritating that nerve, or he had scar tissue that formed that's irritating the nerve that goes into his leg, and that's what the surgery they went back in to do was remove some of those bone spurs or remove some of that scar tissue that may be irritating that nerve. What I hope hasn't happened, which is possible, is he may have had another disc herniation at the level above or levels above. Okay? When you fuse a person's spine, theoretically, they are at more risk for getting a herniation at a level above. That usually happens when you fuse several levels of a person's spine. But if you think about it, you're taking away motion from one part of the spine, so the only place that motion is going to go to the level above or the level below. In his case, the level above, the lowest level of the spine is L4-5, right, which is the disc above it. So if those stresses are transmitted to that level and he has a disc herniation there, then it makes sense about what's being said in the press that he has having fragments of disc being removed. I can't imagine that the doctor who did his previous surgery in Texas, who's a very, very good surgeon, left any disc fragments at that level. When you do that type of surgery, you remove all the disc that's there, put in an implant, fill it with bone, and you fuse that level. So his implant looks similar to something like this, right? So this is the only model of a spine I have available right now. But these are the bones in the spine. These spaces are where the discs are, right? This patient here, or this plastic patient here, polymer patient here, had a surgery where there were 2 discs replaced. Tiger Woods had this one, the one between the lowest lumbar vertebrae and the sacrum, okay, the L5-S1 disc. They took out all that disc from the front, okay, and they did it by not cutting through any of his muscles in the back because they did everything from the back, from the front. They pulled the muscles off to the side, got down to the spine, removed the disc, and put in an implant that looked a lot like this one, that had 3 screws that go into the body, the vertebral body above, the vertebral body below, to hold it secure, and it was filled with bone graft that allowed that to fuse. When they did that surgery, it removed the pressure on the nerves that come out of these little holes here called the neural foramen. Right? So he was pain-free. He was able to get back to playing golf. What I'm thinking is he either had some bone spurs that formed around that window that the nerve comes out that's irritating the nerve, or maybe there was a little bit of disc fragment left behind that was irritating the nerve, but I can't imagine his surgeon did that because he's a very good surgeon. Or he had scar tissue that formed that's irritating that nerve. What I hope hasn't happened is that he had a disc herniation at the level above, and they had to go and remove the disc fragment there, because I think he'll probably end up getting more surgery if that's the case. If it's just bone spurs that they had to remove, and they were able to do this endoscopically, with a little tube that they stick down there and a camera attached to it, they don't have to do a lot of muscle dissection or cutting through tissues, then he can probably get back to playing golf pretty quickly. Okay? If it's a new disc herniation, it'll take off the pressure off his nerve. He'll probably get back to playing golf again, But with the amount of stress that a professional athlete, a professional golfer like Tiger Woods puts on his back, I think he may end up needing more surgery in the future. So if I had a patient like this, I would probably tell them to kind of take it easy for about 6 weeks to let all the tissues kind of calm down. So after about 6 to 8 weeks, when Tiger's back being active again, we'll have to see how he does. If he's not having too much pain, he's playing okay, he might be doing fine. If he goes out again because they're having to do another surgery for a disc herniation, his career might be over, because I don't know if he'll be coming back with a second back surgery. Now, there is a surgery that's called an artificial disc replacement, where they can take out the disc and replace the disc with an artificial disc that allows motion at that level of the spine. It's possible he could have something like that. I'm not sure if he'd be able to play golf at the same level once he had that procedure done. He may be out of pain and be able to live his life and be comfortable. I don't know if he'd be able to play by putting that much stress on that implant. But quite honestly, I don't know of any professional athletes who've had a disc replacement and are back to playing at the same level they were. There have been some athletes who've had spine surgeries who did continue to play for a while. Peyton Manning had neck surgery. Tiger Woods obviously had a disc fusion and won the Masters. Tony Romo had some kind of spine surgery. And there was a hockey player, Lemieux I think is his name, who had a spine surgery. But most of those were not what I'm thinking is happening with Tiger. Let's see what happens, but he may be done with playing golf if this is as bad as it could be. But then again, he's Tiger Woods, and he's a very unusual character, so we'll see.